Ladies and gentlemen, we're back sa second portion po ng ating programa ng Aksyon Central Luzon Special Edition. Pa rin po si Sandy Lopez. At mga guest po natin, dahil ang pinag-uusapan po ay pangkalusugan, specific po sa puso, cardiovascular health, mga kaibigan. Nandito po yung mga kasama natin mula po sa ang head po ng coronary care unit po ng internal medicine and adult cardiology, si Dr. Elaine Payumo. Nandito rin po yung section head ng cardiac rehab ng internal medicine at saka adult cardiology, si Dr. Melissa Frigiliana, and of course my co-host from the Vice President po ng Angeles Medical Society, si Dr. Rowena Medina Mamubad. No? At very, very exciting, the first part of the program. No? I think you have a question now.
Yeah, I was asking Dr. Frigiliana a while ago kasi she mentioned about diabetes and checking for other blood tests. Pero di ba, can you talk more about cholesterol?
Okay. So, yung cholesterol kasi is a risk factor for developing atherosclerosis. So, hindi alam kasi ng tao na through the years, it's a cumulative process. Nagde-deposit na doon sa lining ng arteries. So, yung nagkokos ng pagbabara. Without us knowing it na nagde-deposit yun doon. Kasi sometimes walang symptoms eh. It's very silent until such time na magpa-examine yung pasyente na, ay, ang taas-taas pala ng cholesterol ko. So, once na nag-deposit na yung mga cholesterol doon sa lining ng arteries, progressive na yan, tuloy-tuloy, until mag-block and then heart attack and then there is stroke. So, ang importante sa ating mga pasyente, they have to go for screening kasi sometimes, minsan payat yung pasyente. Bata. Just because of a strong family history na merong early onset ng heart attack, doon lang nakikita na ang taas pala ng cholesterol, ang taas ng triglyceride, okay, ang taas ng bad cholesterol sa katawan. So, we want to emphasize na they should have a screening for the cholesterol, and aside from that, yung fasting blood sugar to check naman and screen for diabetes. Kasi pag may diabetes ka naman, mas madali yung process ng pagde-deposit ng cholesterol kasi nasisira yung mga ugat nila. So,
ano nararamdaman ba nila, doktora, kapag mataas ang cholesterol nila?
Minsan nahihilo. Hilo ang unang nararamdaman. Sometimes patients will come to you complaining, hilong-hilo sila, parang nalulula. And then when you check for the blood pressure, normal naman.
Okay naman. So not necessarily na mataas ang blood pressure or merong diabetes or mataas ang blood sugar, normal ang cholesterol nila.
It will have to be screened.
Sa babae ba, lalaki, mayroong mas predisposed na mataas ang cholesterol, ganyan?
Pareho lang.
Pareho lang, wala.
Kasi sa kinakain no? Although the ladies or the females tend to seek medical attention earlier.
Mas
in general.
maingat,
Because medyo may denial ang mga lalaki. Tsaka yung masculine, nila.
Macho mentality,
yes.
Hindi ako mamamatay.
Okay lang ako.
Seek consultation.
At a later time. Yung females, pag may naramdaman konti, check up na agad yan.
So, Doctor, aside from the blood test, ano pang mga procedures ang pwede nilang gawin? I'm just asking for non-invasive procedures that they could undergo.
Okay. So, for the non-invasive procedures that they can have, depende naman yan sa sintomas ng pasyente. Minsan, kung wala, screening lang talaga, papacheck up lang. We start with an ECG, an electrocardiogram. So, yun yung nilalagay na lead sa dibdib, and then yung tracing, makikita doon na kung may mga suggestive ng pagbabara sa puso, abnormality sa pagtibok ng puso, and then we start from there. So, pagkatapos ng ECG, kung makita natin, merong mga nagsasuggest ng pagbabara, we suggest to have an echocardiogram. It's a 2D echocardiogram. Yes, 2D echo. Parang ultrasound niya ng puso to assess yung cardiac anatomy, yung mga valvula ng puso, at saka at the same time, kung para makita mo yung pagtibok ng puso, yung muscle ng puso. Kung normal, kung may pumapalya or humihina ng pagtibok. And then, i-correlate natin sa symptoms niya. Kung wala tayong makita doon, kasi yung echocardiogram, resting lang yan or nakapahinga yung pasyente.
So, hindi rin lahat makikita doon?
Hindi rin lahat makikita doon. So, we proceed with the stress test. Pwedeng treadmill or pwedeng yung dope stress test para makita natin habang pinapagod yung puso, okay, makikita natin doon kung merong suggestive ng pagbabara.
So, yun yung pinapagod nyo sila, right?
Yes, oo.
Pupunta ka sa naka-treadmill ka, pinapagod ka nila, tapos naka-hook yung mga monitors sa'yo. Pero ito yung mga stress test na Sa ospital lang
Sa
ginagawa.
ospital, yes,
Kasi
oo.
kailangan with the supervision of a doctor. Kasi
Yes.
kung biglang nagkaroon ng changes,
Delikado din naman yan. Oo.
So, after nun, meron pa, di ba, kung halimbawa hindi nyo makita doon, yung pwede nilang iuwi sa bahay nila for the whole 24 hours na i-check sila.
Oo. Yun naman yung 24-hour Holter monitoring that we also have at AUF at saka yung 24-hour ambulatory BP monitoring. So, depende sa compelling indication. Kung halimbawa, ang complaint ng pasyente parang nagpapalpitate, okay? We suggest the 24-hour Holter.
Kasi hindi naman mahuhuli.
Hindi
At the
mahuhuli
same time
yun
na nagpa-stress test
Yes,
ka.
oo.
So, kailangan the whole
The
time.
whole time.
24
Yung activity ng
hours.
pasyente, makikita
Check.
dapat. Okay, kung anong mga activities na nagpe-precipitate.
Tapos naka-record yun.
Then, naka-record yun for 24 hours. Yung ECG nun naka-record.
And then, what else?
And then, kung halimbawa wala talagang makita doon, we will suggest for an invasive procedure. That's when we do the angiogram.
So, that's Dr.
Yun
Payungos
naman ang-
expertise.
Angiogram sa'yo.
Angiogram. So, ang angiogram naman po is an X-ray ng mga ugat ng puso. So, it is very specific. Usually, pag may signs na may bumabara sa puso, like nag-positive yung mga ECG or 2D echo, may findings sa treadmill, that indicates na meron talagang bumabara or the patient already had a heart attack. So, yun, it's already an indication. Ngayon, the procedure would involve, may parang maliit na tusok lang sa singit or sa kamay, sa ugat doon, papunta sa heart. And then, once nandun na tayo sa heart, susungkitin yung ugat ng puso. We have two arteries, isa sa right, isa sa left. Isa-isa natin yung susungkitin using thin tube, which is tawag namin doon, catheter. And then, once na sungkit na siya, mag-i-inject ng tina or dye. And then, after nun, pag-inject, i-x-ray na yung lahat ng mga, yung ugat. Then,
Lalabas
different, yes, and different angulation, parang nag-picture taking, may front view, may side view, left, meron sa right na view, and then we will reconstruct to give us a comprehensive picture ng mga ugat. And from there, we could see kung meron bang, kung normal ba yung ugat, smooth, kagaya na sinabi ni Dr. Frigiliana, kung yung lining ba is maganda, so smooth ang itsura. Or kung meron bang bara, yun yung mga bara-bara ng cholesterol or tinatawag sa Ingles na plaque formation. And then yung severity nung pagbabara, whether mild lang ba or moderate ang bara, which is makukuha pa sa medication, diet, and exercise, or kung grabe na yung bara, severe, na kailangan additional procedure.
Like
no amount of medication
or
will be able to
exercise or diet change,
Yes.
andyan na yan.
Yun na dapat yung mga procedures na, additional procedures na gagawin. So among this, yun nga, yung procedure is the angioplasty. We have, it is a process naman na bubuksan yung baradong ugat. The same din, kagaya ng angiogram, meron ding special na catheter or tubo papunta sa puso. This time, yung tubo na yon or catheter, meron siyang balloon sa dulo. No, parang nagbobomba, parang nagpa-plumbing. Itatapat natin yung balloon dun sa bara at bobombahin.
Bubuka yung ano? Yung
Para, yes, to open up the artery. Para
matatanggal ba
dumaloy
yung bara
ulit. Yung bara is pupunta siya dun sa gilid. Nandun pa rin yung bara. However, mabubuksan na yung ugat. And after that process is yung stenting, paglalagay ng bakal dun sa area na may bara para mas-support yung ugat na hindi na siya babara ulit. So that's the angioplasty.
Permanent yan, nandun yung
Yes,
stent
permanently it will be, it's there, and then later on yung ugat magpo-form ng bagong lining. So ma-incorporate na siya dun sa ugat. Or kung we could do this.
Meron na ba tayo dyan dito?
Actually, yes, we are very fortunate that in the whole of Central Luzon, we have a functional catheterization laboratory in Angeles University Foundation. And to date, this November, it has been functional for already 1 year. And the procedures, it's around 150 cases already.
Oh, marami-rami na rin
Yes,
pala yung...
both diagnostic, yung mga angiogram, and yung mga therapeutic, which is the
So
angioplasty.
before you have to go to Manila, di ba?
Yes.
Manila ka pa, hindi mo man alam na
And
meron.
you should remember that these are non-invasive. Ang ibig sabihin po, hindi po bubuksan yung puso ninyo. Hindi po bubuksan yung
Dibdib,
chest nyo para
operahan.
doon gawin yon. So, meron maliliit lang po ng mga gamit na
Tusok lang.
ipapasok, tapos tutulungan yung na makakatulong sa kanila.
So, to emphasize po yun, isang tusok lang po yun sa singit. And we are able to fix yung bara. Bubuksan natin yung bara without having to undergo yung open heart operation wherein bubuksan or ooperahan, lalagariin yung dibdib or yung buto para mabuksan yun. So, tusok lang po sa singit, which is parang kagat lang ng langgam.
And it is
ang
more
mararamdaman na pain.
affordable, of course, kasi hindi nga siya invasive na procedure.
Yes,
Plus,
and yung
Sagot
recovery,
ba yun ng insurance?
may part na sasagutin ng insurance. Usually, pag angiogram, sagot na siya ng insurance. But if we proceed, we have to proceed to the angioplasty, pagbubukas, which is a little bit expensive, then shoulder naman ng insurance part of the procedure.
So as you said, meron na tayo ngayon dito in Angeles City. No?
Yes.
So Angeles University Foundation po, mga kaibigan. No? At sabi niyo, 1 year na yan.
1 year.
At makagawa na po
So,
sila ng...
who
150.
spearheaded with
Sino mga kasama dyan?
mga doctors, kasi I know na prominent doctors from Manila in the cardiology world are involved in this venture. Right?
Yes. So those who spearheaded this cardiovascular institute, as we call it, are the group here in Central Luzon, Dr. Edgardo Timbol, which is the head of the Cardiovascular Institute of AUF, of course together with the president of AUF, which is Attorney Gabriel Martin Angeles from the Pampanga side. Now from the Manila side, it is the HB Calleja group, which is headed by HB himself, or Dr. Homobono Calleja, who is the founder of the Heart Institute of St. Luke's Medical Center. Boss namin ni Dr. Prigiliana.
Pero yung gamit niyo ba diyan bago? Baka naman 20 years old na yan, hindi na lang dito.
Tama po kayo, bago siya. Because
But this is not without risk, right? Hindi naman po namin sinasabi na 100% na walang complications. Of course, like any procedures that they would undergo, there are certain risks na pwede rin mangyari. So,
although yung risk naman po, you don't, tama si Doktor, yung risk naman po is minimal compared to the open surgery. The risk is usually less than 1% lang for any complications. These are
so the benefit is more compared to the
yes,
risk.
the benefit.
And also depending on at what time or at what point in time you catch the
So
patient.
timing is very important
Yes,
for those who have
oo.
Heart problems.
Yes. Kung halimbawa, if the patient comes into you with mild symptoms, of course, you expect that the plaque or the blockage or yung pagbabara are milder. So, mas madaling remedyohan. And then, pero kung halimbawa, dumating sa'yo, nakatatlong beses na palang inatake sa puso without them having any consultation or doctor's advice, syempre, pag dumating sa'yo yan, nag-angiogram ka, nag-do angiogram, most of them, 3 vessel yung affected. So, yun yung medyo mahirap nang gawin. Kasi sometimes, malaking ugat yung tinamaan. So that's the time we suggest naman the bypass surgery.
Okay, but when do you go? When you suffer, or you are suffering a heart attack, gano'ng katagal bago ka dapat magpunta sa doktor? Pag nakikita mo na yung mga symptoms na sinasabi nyo, nafe-feel nyo na sa katawan nyo, sigurado na. Mabilis ba dapat ang pagpunta sa...
Actually, immediately.
Immediate, yan.
Yes.
The soonest.
Kasi nakakamatay po ang heart attack. The sooner, the better that you have to. Once you already feel yung symptoms, ngayon, yung timing nga. Usually, if it is just 5 minutes or mga few minutes lang siya, pwede namang mag-take ng medicine, yung sublingual na gamot or mag-rest. Pero kung more than 15 minutes na siya, tapos iba na talaga, parang impending doom, severe pain that you've ever felt, tapos may pinagpapawisan pa kayo ng malamig, yun, punta na talaga kayo. Heart attack na po yun.
Dapat magpa-ambulansya ka na, magpahatid ka na. Kaya magpunta ka na sa
emergency room.
Oo, sa emergency room. Yan po mga kaibigan. So those who are listening to us right now, I hope you get the cue from what we are discussing here, especially if you are predisposed or you have the factors that they have been discussing as who is a candidate for a heart attack. No? Magbe-break po kami ulit, and after the break we will conclude today's program. Dito po sa ating focus ngayon, ang pangkalusugan po sa puso. No? Balik po kami.